Dizziness in pregnancy. Why does that happen? Well, it's because of two most important things, or three. One is low blood pressure. That's a common pregnancy change. It's very common for most pregnant patients to experience dizziness, especially when they were lying down and they suddenly get up because their blood pressure comes down, or they're just like constantly feeling dizzy. That's again a pregnancy change because your blood pressure is always on the lower side in pregnancy so that the baby keeps getting the good blood supply. Second reason for dizziness is low hemoglobin, is when you get anemia, because our blood starts diluting in pregnancy. So if our hemoglobin was 11, it will go down 2 grams and it can go up to 9 grams. And when that happens, when your hemoglobin starts to drop, what happens is your each and every organ cells don't get enough oxygen, and then you start experiencing the dizziness when it happens to your brain cells. The third reason is when your sugar is low or is very high. Again, the diabetes. So when you experience dizziness, go and get it checked. If your blood pressure is low, that's fine. You can have some salt cracker and it should be okay. If your hemoglobin is low, then you need to start taking iron tablets. Slow and steady, but you need to start taking your iron medication because it's a correctable problem. If you can't fix your iron with tablets, you can't have the tablets because you don't like eating tablets, or it causes you a lot of side effects, then you can always ask for an injectable iron option. Iron-rich diet is another very good option, and I will make another video on that. The third cause is diabetes. Either your sugar is coming down too low or is going very high. So check that sugar and get it checked if you are actually having diabetes in pregnancy. And if you are having diabetes in pregnancy, are you maintaining your sugar control well? If the sugars are not if this sugar control is not good enough, you need to go and show your food sugar entry diary to your doctor to see why that is happening. Maybe you need a higher dose of metformin, or you need a higher dose of insulin, or we need to reduce it. Something of that kind needs to happen, or you need to eat a little bit more, or you need to eat a little bit less. All of that can be handled. And if everything is fine and you still experience a dizziness, maybe that's how your body is. And in that case, when that happens, when you're constantly feeling dizzy, you might need to see a neurologist, because there are certain conditions wherein our autonomic nervous system is just producing severe dizziness. Like I have seen patients who have fainted, like while driving. So that can be very scary, and they have crashed a car. So if that is something, it's a very rare thing, it's not that common. And it's important that if that happens, you need to go and check with your doctor, internal medicine, neurologist, and get that thing sorted, because that is not common. So if you are someone who's experiencing dizziness and you fear this is going to happen, trust me, it will not happen. It's a very rare thing. But always take care. Like if you start experiencing the dizziness, sit down. It's like your body is telling you something. Sit down, take a rest, slow down. Once you feel better, get up and start doing whatever you're doing slowly. There is really no hurry. Everything can wait. Nobody's dying. And if you are in a job like a healthcare employee who thinks that someone might die if I don't run, trust me, there are a lot of people who can come and take care of that patient or something, even if you are not there.